The term pelvis means a basin and it refers to the skeletal ring formed by the three bones, two hip bones and the sacrum. The skeletal pelvis refers to the, otherwise it is in between the femoral heads and the fifth lumbar vertebra. The skeletal pelvis is formed by the three joints, two sacroiliac joints and pubic symphysis. The sacroiliac joint, it is the strong weight bearing and it with little mobility, and it is very typical. It is formed of two joint types: anterior plane joint between the ear shaped auricular surfaces and between the posterior tuberosities of the iliac bones. It is the type of the syndesmosis. So it is actually this joint is very typical and it is represented by the term amphiarthrosis type. So this is that between the ear shaped auricular surfaces plane joint and between the posterior part it is the syndesmosis. Sacroiliac joint has three ligaments, one anterior, one posterior and the interosseous sacroiliac ligament. Anterior, so the name represents the antero-inferior capsular thickening, and it extends from the posterior inferior iliac spine to the, and it is prominent near the arcuate line and posterior iliac spine. It connects the third sacral segment to the lateral side of the preauricular sulcus. This ligament represents the typical syndesmosis type of the joint in the body. Actually, this is the major ligament which is responsible for the weight bearing action in the sacroiliac joint. Posterior sacroiliac ligament lies over the interosseous ligament, and between these two ligaments are the dorsal sacral nerves and the vessels. So this one slide represents all the three ligaments of the sacroiliac joint: anterior ligament and interosseous sacroiliac ligament, anterior ligament, interosseous sacroiliac ligament, and over the interosseous posterior sacroiliac ligament. The pubic symphysis, again it has three ligaments, and it is the pubic bones are connected by three ligaments: superior pubic ligament, arcuate pubic ligament, and the in between the medial surfaces interpubic disc. The superior pubic ligament, as the name represents, connects the pubic tubercles. Arcuate pubic ligament, so this is the one picture to represent the pubic symphysis. The upper surfaces are connected by the pubic superior pubic ligament. Lower parts are connected by the arcuate pubic ligament. Medial surfaces are connected by the interpubic disc. Arcuate pubic ligament, it is a thick arch of fibers bounding the lower part. Interpubic disc connects the medial pubic surfaces, and it is covered by the hyaline cartilage. In between the hyaline cartilage, fibrocartilage. So these three joints connect the skeletal bony pelvis, two sacroiliac joints and one pubic symphysis. Apart from these three joints, we have the other ligaments of the bony pelvis also, which are named as the vertebropelvic ligaments. Iliolumbar ligament, it is connecting the ilium and the fifth lumbar vertebra. Sacrotuberous ligament, which represents the degenerated part of the long head of biceps femoris, it is connecting the posterior superior iliac spine, ischial tuberosity, to the lateral margins of the sacrum and the coccyx. So this picture represents the two ligaments which are not related to the joints: sacrotuberous ligament connecting the ischial tuberosity and the posterior superior iliac spine and the sacrum and coccyx. You can see in this picture, sacrospinous ligament is anterior to the sacrotuberous ligament. Sacrospinous ligament connecting the ischial spine and the lateral margins of the sacrum and the coccyx. So all these ligaments represent the ligaments of the bony pelvis. We will see quickly the ligaments of the hip joint. The type of the hip joint, spheroidal type, multiaxial, and the articulating surfaces are the acetabulum and the head of the femur. So this picture represents the articular lunate surface and non-articular acetabular fossa in the acetabulum, and this head of the femur, which is about 2/3 of the sphere and contains the fovea in the center. Ligaments we can classify as intracapsular and extracapsular. The first three are the intracapsule and the intracapsular, and the last three are the extracapsular ligaments. Capsular ligament attachment, it is above, it is near the acetabulum, it is attached to the acetabulum and also just beyond the acetabular labrum also. So that is the upper attachment. So this picture represents the capsular arrangement of the hip joint, which is typically attached behind above the intertrochanteric crust. Below, when it attaches, in front it is attached to the intertrochanteric line, and behind above the intertrochanteric crust, and typically along the roots of the greater and lesser trochanters. Synovial membrane, it covers the intracapsular part of the femoral head, and also the ligaments inside the capsule are covered by the synovial membrane. The ligaments inside the capsule are the transverse acetabular ligament, ligament of the head of the femur. They are all covered by the synovial membrane. So this picture represents the synovial membrane covering not only the capsule, femoral head, transverse acetabular ligament, ligament of the head of the femur. So the acetabular labrum, it's a fibrocartilaginous rim attached to the acetabulum just to deepen the socket of the acetabulum. Transverse acetabular ligament is covering the gap in the lunate fossa, lunate surface, and it blends with the base of the ligament of the head of the femur. Ligament of head of femur is having a triangular shape. One end is attached to the femoral head apex, base is attached to the transverse acetabular ligament, and its main function is to convey the blood vessels. So this is the ligament of head of femur converts this into a tunnel-like appearance through which the blood vessels enter the joint. So this is the ligament of the head of the femur. So the three ligaments outside the capsule, iliofemoral ligament, the strongest ligament, and it is other name is ligament of Bigelow. It is typically Y-shaped, inverted Y-shape, and the apex of the Y is attached to the anterior inferior iliac spine, and two bands are attached to the intertrochanteric line, and this ligament prevents the hyperextension of the hip joint, and this picture represents the tightening of the iliofemoral ligament in the extension. Pubofemoral ligament, this is attached to the iliopubic eminence, obturator crest, and it blends with the iliofemoral ligament. This ligament prevents extension and abduction also. So this is the picture of the pubofemoral ligament connecting the obturator crest to the Y band of the iliofemoral ligament. Ischiofemoral ligament attached to the ischium, and it is below, it is blending with the fibrous capsule. This ligament also limits the extension. So this picture is the ischiofemoral ligament. So summary of the ligaments of the bony pelvis and the hip joint: sacroiliac joint, 3 ligaments, anterior, posterior, and intraosseous sacroiliac ligament. This pubic symphysis, superior, arcuate, and interpubic disc. Apart from this, sacrotuberous and sacrospinous ligaments are also attached to the pelvis and the iliolumbar ligament. Ligaments of the hip joint: capsule with synovial membrane, and transverse ligament and ligament of the head of the femur inside the capsule. Outside the capsule, iliofemoral ligament, pubofemoral ligament, and ischiofemoral ligament. And I thank everyone for this for patient hearing, and thank the Department of Orthopedics.